My name is Caitlin Patrician. I'm a first-year doctorate athletic training student at Indiana State University, and today I'll be discussing a ligament sprain in the ankle, specifically a lateral ankle sprain, grade 1, versus a medial collateral ligament sprain in the knee, grade 1. So what is a ligament? A ligament is a band of fibrous connective tissue that attaches bone to bone, stabilizing the joint and helping guide through a normal range of motion when a load is being applied. A ligament is non-elastic, so it can only take on so much force. When the force exceeds the ligament that can be stretched, we see a micro tearing in the ligament itself. This can cause specific pain, laxity, inflammation, causing our patient to not be able to function properly. We can grade these on a scale from grade 1 being acute and having minimal micro tears to a grade 3 being a complete rupture. So how does this relate to the ankle and the knee specifically? In the lateral ankle, we see that there are 3 ligaments, while in the knee, we see there's only 1. The 3 ligaments in the ankle are the anterior talofibular, or ATF, the posterior talofibular, PTF, and the calcaneofibular, or CF. These all have a common functionality. However, in a grade 1 ankle sprain, we mostly see the ATF injured. The common mechanism we see is a plantar flexion and inversion mechanism. Meanwhile, with the knee, there is only, again, one lateral ligament, the medial collateral ligament, or MCL, which we commonly see injured during a valgus force, so the knee caving in from the outside by being hit or cutting and turning. Some commonalities we see is that they are both a hinge joint. They both have the similar range of motion. A ligament, at the end of the day, is a ligament, so it functions the same, it heals the same, it'll take the same amount of time. However, we see that they are all patient-specific. Some can return the same day, some take a little bit more time. Depending on how the patient is functioning and showing us how they can function, will determine when we are able to let them return to play. Some differences between the ankle and the knee, again, the ankle has 3 ligaments, while the knee only has 1 on the lateral side. The mechanism of injuries are different. The mechanism for a knee, again, is a valgus force. The ankle is a plantar flexion inversion mechanism. We also see different muscle groups. The ankle has more intrinsic and extrinsic muscles that are broken down into 4 compartments. Meanwhile, the knee has a larger muscle group such as the quads, hamstring, ab and adductors, and internal external rotators. This can cause a longer recovery time because, as we see with injury, muscles tend to brace and try to protect the area. When a ligament is injured, the muscles tend to take over to try and stabilize, and with these larger muscle groups, it can impact how we function due to them trying to stabilize and tensing up. We also see the knee can be associated with other traumatizing injuries such as meniscal or ACL. So how come a lateral ankle sprain, grade 1, seems to return a little bit sooner than a grade 1 MCL sprain in the knee? As we mentioned, they have different functions. The ligaments, they have 3 ligaments compared to a singular ligament. The musculature is different. When we see a ligament injured, the muscles tend to take over as stabilizers, and the knee has larger muscles that need to stabilize, and sometimes we don't see that happening. However, we cannot really base it off specifically those. We must also base it off of what our patient is showing us. With these symptoms, if the patient has a limited range of motion and cannot function properly, with a knee, it is difficult to return them sooner than an ankle, and vice versa. You also can't compare because a ligament heals the same, so it's all patient-specific. With an ankle sprain, with being reoccurring, we can see a longer recovery period over time. However, we really want to try and limit the amount of ligament sprains we see because, as we know, they are inelastic and they scar over, causing it to be an issue later in the future. So an ankle sprain tends to return sooner than a grade 1 knee because of patient specifics, the patient-reported outcomes that we are collecting from them, their pain level, how are they able to function, how are they feeling like they are functioning, and the clinician outcomes that we are collecting, such as their range of motion, their strength, how they are able to functionally test out. So we see more often in the knee, it takes a little bit longer, specifically because of the stabilizing factors compared to the ankle, where we are able to help brace it, and typically has a sooner return time. Here are my references, and thank you for watching this presentation.